functional nutritionist. She has space in my practice too. Got a reading interventionist, and we're going to continue to add things like this. So that's what I'm doing now. I have other business ventures as well. I love teaching. I've taught for almost a decade now, anything from chiropractic to functional neurology. Now I'm really focusing on laser therapy specific to the brain. That's really what I've been focusing on for the past 2 years. I was asked to consult in various places around the world, but especially the UAE, in the Middle East. I was asked to go over there and consult about autism and various spectrum disorders, and now we're getting ready to launch some clinics there, me and a few of my partners. So a couple of years ago, I founded a company called Shed Light, and that's kind of where we're going right now, and that's why we're here, because the topic for tonight is laser and light therapy specific to rehabbing the brain. And so I've always used laser therapy. It's always been a big part of my practice. Early on in my career, I was being mentored by the president of the Functional Neurology Board, and he had a really interesting and difficult case where genetically a kid was not developing the gyri in the brain, or the folds in the brain. And I asked him, I was like, well, what are we going to do about this? And he said, I don't know. I said, okay, great. But he said, there's limited research. At that point, it was limited. At this point, it's not. At this point, there's hundreds of human clinical trials. But back then, we didn't have as much information on this topic. And so he said, how about this? We're going to laser the brain. And I said, great. And so, he started doing that. And the child actually grew and developed relatively normal, to the point to where the neurologist said, I guess we misdiagnosed him. So I knew there was something to it at that point in time. And it really got me thinking. I'm a pretty logical thinker. And so I also have a strong faith. And so in my mind, I went back to the beginning and I said, okay, in the beginning, God created the heavens and the earth. Well, the next thing that, he brought about was light. He said, let there be light. And he did that before there were living things on the planet. So in my mind, I said, okay, this is important and I need to pay attention to this, because before God created man, before God created animals, before God created plants, before all that happened, there had to be light. And we know that life cannot be sustained without light, because if you go, you move off to somewhere without sunlight, you start developing seasonal affect disorder, you start getting depressed, your gut stops working correctly, and various other things. And that's in a short period of time. So there has to be something to this, right? So that's what really got me thinking. Now, there's a lot of different parameters about light that need to be considered. There's wavelength considerations, there's power densities, there's frequencies, and all these things. And we're going to get into those. But what I really want to do is kind of break down how laser and light therapy works, some specific applications to the brain, and then I'd like to talk about functional neurology and functional neurology applications, because that's really the direction of where I'm going, is how does this apply to the brain, and how can we activate brain networks that have been dormant or injured or whatever. So that's what I want to do. I want to, kind of briefly discuss that. I want to give you my little, spiel, if you will. And then I really want to open the floor, because each one of you are on this call for a specific reason. So I want to make sure that we can answer as many questions as possible. So like I was saying, light's super important. We're very responsive to light, and that's because of this. We have little receptors scattered throughout our entire body, both on the inside and the outside. Those receptors are called chromophores. Their sole purpose is to receive photons. Photons are a little unit. It's a little unit of energy. It's what forms light. Now, depending on the type of chromophore it is, depending on the type of wavelength of light and all that kind of stuff, you get various responses. The most heavily studied chromophore in our body is our cytochrome C oxidase chromophore. So what happens is this: you get this little packet of energy, this photon that comes into our body. It hits our skin, it's absorbed, it goes in, it excites the cytochrome C oxidase, and it generates what's called ATP. So it really generates some activity in the mitochondria and gives us ATP. Now, ATP is the fuel source for our cell. So that's really important. If a cell needs to heal, if it needs to produce a neurotransmitter, if it needs to do whatever it needs to do, it needs more ATP in order to do that efficiently and effectively. So a very basic, primary example of how this works is when light comes in, it generates ATP within our cells, and that gives our cells more energy to heal and to do whatever kind of work it needs to do. Now, at this point in time, I get a lot of questions about, but wait, how can that cross into the brain, right? Because you have something called a skull, and the skull's bone, and not much light's getting through that. Well, here's the thing. That skull is still living tissue. That skull has chromophores. Therefore, it will receive and transmit particles of light. So at this point in time, there's so many different research studies that say, yes, in fact, you can penetrate the skull with light. You can have an effect on the brain. It's pretty much, accepted everywhere that is true. And that was not true just a few years ago. There were still people saying that, no, it can't go through the skull. This isn't possible and all this kind of stuff. But in fact, it can, and it's, pretty well established at this point in time. So there's that. Now, like I said, there's various types of chromophores. So you're going to get a whole host of different types of responses, depending on the chromophore and dependent upon the wavelength of light. One thing that's kind of interesting to note is that a large percentage of the sun's rays is in fact red light. So we know that red and infrared light is super important because that's what makes up the majority of the sun's energy coming down at us. So that's something that I found was really interesting too. And in fact, when you look at the research done, the majority of the research has been done on red and infrared light. Now, there's that story, but there's more to it. Okay, there's more to the story. And this is where I've really taken my work and started asking a lot of interesting questions and started combining things like quantum physics and things like that, because there's an immediate response whenever you use laser therapy on the brain. And, these chromophores don't always answer the questions of why that happens. So I started, reading a bunch of physics books, which I hate doing. I really don't like physics. I was in my office one day, and it was probably 11 o'clock at night or something. And my wife walks by, and I'm like reading all these physics books, and I've got all this physics information. She's like, "What are you doing?" I'm like, "I don't know, but there's answers here. I got to find it." So what I found was this. Albert Einstein actually discovered the photoelectric effect. And that's really significant because what happens when that photon that we were talking about comes in and it hits you at a molecular or at a atomic level is it starts to bump out the electrons. Now we're going to talk about why that's so important, because I started asking the question, what does it take to heal one cell, right? So if we can figure out how to heal one cell, we can figure out how to heal a human body or a brain or whatever it may be. So a typical cell, a typical healthy cell is going to operate at a pH range of 7.35 to 7.45. This is well established within the medical text. You can look at any biology textbook out there. So that pH range is really important, and everyone knows this, but no one's checking this really, right? People are checking heart rates and, respiration and your O2 saturation, your blood pressure and all this kind of stuff, but no one's really checking your pH. And here's why that's so important. Your pH directly correlates to an electrical potential in your body. So 7.35 to 7.45 correlates to a minus 20 to minus 25 millivolts. Now here's where it starts getting interesting. Whenever a cell is damaged, doesn't matter what happens, you can hit your thumb with a hammer or have any kind of severe traumatic injury. Those cells, no matter what type of cells they are, they have to increase their voltage to minus 50 millivolts. Okay, you follow? Now, that correlates to a pH. Whenever you increase the voltage, that means you're becoming more alkaline. And again, there's a direct correlation. I'm not making this up. You can look at the biology text and you can read it in the form of pH. Okay, so we have to increase our voltage, right? We have to become more alkaline. If we don't do that, we won't make new cells. Okay, so if we don't make new cells, we're not going to heal. So that's a very, very, very important thing to consider here. Now, the photoelectric effect comes in and is so important because when you shine the right wavelength and the right frequency and the right power and all that kind of stuff, when all that comes together and you hit it right, what you're going to do is you're going to create a photoelectric effect. You're going to start to bump out electrons from those shells and the atoms, right? And they're going to bump out into the tissue and they begin to raise the voltage. You understand? Now, I don't care if you have chronic organ dysfunction or chronic pain or a brain injury or whatever it is. At the very basic level, we still have to have our cells increase their voltage in order to heal. You understand that? We good? So again, we shine light. We're going to have an effect on chromophores. Those chromophores are going to do a whole host of things. They're going to generate ATP. They're going to start to regulate hormones. There's opsins in the brain, which is another type of chromophore. We're going to start to generate reactions in the pituitary and the hypothalamus. That's what gives us our circadian rhythm. That's all controlled by light. But then at an even, what I think, more important level is we start to increase the voltage of our bodies. We start to increase the global voltage. If we use a certain wavelength, we start to increase our local voltage if we use a certain wavelength, and that's where it gets really interesting. So, that's really what I've been looking at for the past couple of years is, how can I leverage this? How can I create this voltage effect and really see advanced healing at a faster rate? And, then even more important, how can I prove it? Okay, so now we start talking about the functional neurology world, right? Because again, my background is chiropractic and functional neurology. What I do all day, every day is I look at the brain and I go, okay, I see dysfunction here. I'm going to do this exercise or this activity or whatever it is. I'm going to recheck that functional measurement and make sure there was a change. Because if there wasn't a change, then I failed, right? And that's what it's all about. It's about making change as fast as possible and then sustaining it. So I said, okay, I've studied under Dr. Robert Malillo my entire life. He's now, we're partnered. We do various things. I teach with him. We're teaching the childhood neurodevelopmental disorder course together. My portion really focuses heavily on, what I'm talking about now, laser therapy, how it affects the brain. But because I had, his knowledge, and a lot of his work is grounded in Dr. Muscatova's work with MNRI, dealing with primitive reflexes, so I think most people on this call understand who that is and how significant that is. So what Dr. Malillo has done, he's been researching for the past 20 years about how can we best and most effectively use these primitive reflexes? How does it apply to functional neurology and functional connectivity? And in the hemispheric-based model, of brain function and development, which is really important, by the way. So let's take a little segue and let's talk about brain development, if you will, if that's okay with everyone. Because the brain develops in a very specific way. There's a blueprint to brain development. It's not just this generalized poof, you have a brain type of approach. You have to go through the brainstem networks, and then you have to fire the cerebellum. The cerebellum fires into other subcortical networks, and then you start developing the cortex, but you develop it in a very specific pattern. Your right brain networks turn on first, your right brain networks come cross over and start to build the left brain networks, and then there's an oscillation back and forth throughout your life. Now, the right side of your brain starts developing in utero, and it really develops all the way up till about age 2 or 3. And then you really heavily start developing the left side of the brain. Now, some kids who are, quote, more advanced, maybe they're developing more left brain networks at the time, maybe they're developing more left brain networks at like age 1.5 to 2, and they're starting, they're very verbally astute, they're, more academically, they're ahead of their cohorts and all this kind of stuff. So we can apply this in very, very different ways. But and the reason why I said that is because I was having a conversation earlier about, well, why did, when my child lose these abilities and these abilities are still intact? Well, it really has to do with something about, what networks were developing at that point in time of the brain injury. And what areas of the brain were more susceptible at that point in time in their life, especially for a child, because networks are, are developing so rapid at that point in time that, certain very specific localized networks can be damaged more so than others, even though, on imaging, it's a quote, global brain injury. So, so that's what I've, been playing with, is the fact that, okay, we have this developmental functional neurology hemispheric based approach. How can I test what I do? How can I apply what I do with laser therapy and then know that it works? So here's how we came across this is we were testing primitive reflexes, and Dr. Malolo said, well, tell you what, if it works, it's going to make that primitive reflex go away. I said, great, let's test it. So that's what we did. We found someone with an asymmetric tonic neck. We lasered the area of the brain that we identified was weak. The asymmetric tonic neck reflex went away. And we were obviously very impressed. We said, okay, wait, no, that didn't just happen in a matter of seconds. Let's try that again. So again, we found someone else. We did the reflex. It goes away. It's like, okay, that's phenomenal. Now, depending on the nature of the injury, depending on the severity of the injury, it may not happen in seconds for everyone, clearly. However, we were testing individuals that did not have severe brain injuries, but they still had retained primitive reflexes. So at that point in time, I knew that this worked. However, here's the interesting part, is we went, well, let's laser the other part of the brain that we don't think is weak. So we did that, and guess what happened? The reflex came back. Now that's very significant. So we can laser a part of the brain that we thought was weak, the reflex goes away. We can laser a part of the brain that we did not identify as weak, but in fact strong, and the reflex comes back. So we're doing a couple of things here. Number one, we're confirming that the hemispheric-based model is true, which we have other, obviously there's lots of literature on that at this point in time. But we're also proving that we can have a direct effect with laser and light therapy on the brain in a very specific hemispheric way. Okay. Now, there's more to the story too, because you can take other products with different power densities, with different wavelengths, with different parameters like that, and you can try to do this and replicate this, and you typically fail. And again, I'm not saying anything bad about those products because, whatever, but, I get phone calls and emails often that say, hey, I'm using your methods and we're not seeing results. And I go, great, what product are you using? And they tell me the product, and I say, it's not powerful enough. And that's typically my response, because there's a lot of very, very low power devices on the market. One that I'm asked about quite often, and again, I'm not picking on anyone, but is the QRI, the one that they use for what is it called? The quantum reflex integration, I think is what it's called. I get questions about that all the time, and when you look at the parameters of that, it's two 5 milliwatt 650 nanometer diodes, which is your red diodes, two, I think 408 nanometer, which is your violet diodes, and then one 5 milliwatt infrared diode. That's 25 milliwatts of power. That's not very much. And they're different wavelengths. So it's really just 10 milliwatts, and 5 milliwatts. I use 1,000 milliwatts of red, or the 637 nanometers, and I use 1,400 milliwatts of infrared. I've done studies and tests with higher powers, and I still get good results with that. In fact, sometimes I get better results with that. And we're developing a laser that actually has more power right now. So, it really comes down to, well, if you're not getting results, there's a reason. Let's figure out what that reason is. Oftentimes, there's not enough power. Maybe you have the wrong area of the brain, so on and so forth. But so that's really what I've been doing is taking laser and light therapy, applying it within the functional neurology field and going, number one, where's the weakness in the brain? Where are you in this developmental trajectory? And how can we best leverage laser and light therapy to try and induce growth and network connectivity and better stabilize these networks? One founding principle of functional neurology is fuel inactivation. If you don't have adequate fuel for these neurons, for these areas of the brain, it's very difficult to safely activate them. And early in my career, you had to be very, very careful about how I activated the brain. I had to be so on top of these people and watch for metabolic fatigue, because you don't want to tire anyone out too quickly, and you want to be very careful about that. But now that I'm using so much laser therapy, it provides fuel for the brain. Again, that's ATP, right? So we're providing fuel for these brain and for these networks, and then we're able to better activate the brain, and we can do it in a much safer way. So again, that's functional neurology. Now, I don't want to get too detailed. I want to stay, really more focused on the forest with, these applications and whatnot. But if you have a very detailed question, that's fine. Go ahead and ask it. But what I'll tell you is this: laser and light therapy, it's been extensively studied. Light therapy in and of itself has been used for thousands of years. Laser therapy has been used since the 1960s. There's thousands of research studies, thousands of animal-based studies, and hundreds of human clinical trials that have been done. I've been asked to begin to do research. I'll be doing research at a lab in Cuba. It's an FDA-approved lab. I'll be doing research with a group out of Brazil who's connected with Harvard. So the safety of this modality is honestly, you can't really compare it to anything else on the market, in my opinion. And not really in my opinion, just to be honest. You can back it up with the literature too. In fact, I'll reference this. There was a study done 2 or 3 years ago. It was by the group at Harvard. It was Dr. Hamblin. Dr. Hamblin did a study, and he said that because of the lack of adverse events with photobiomodulation, which is laser and light therapy, that they can really. I wish I would have memorized this, but basically, look, there's basically no side effects. It's extremely safe and effective. That's basically the statement that he said. So it really is one of the safest modalities on the market. When you look at dollars spent on research, the only thing that is above it is stem cell, right? So you have stem cell research, and then you have laser and light therapy, and those are the main things being researched at this point in time. When you start looking at the health field. So extremely safe, extremely effective, very exciting. But again, wavelengths matter, power matters. And then something else that, people don't really talk about a lot, or really, just to be honest, don't understand, is frequencies matter, okay? Now, I'm just going to talk about it from the standpoint of brain function. I could talk about this topic for the rest of the night. But when we start looking at why frequencies matter, it's just a question of what is brain function? Well, brain function, let's think about EEGs, right? So when we look at EEGs, we're recording brain waves. All right, so we have brain waves. There's alpha, delta, beta, gamma, all these different brain waves. What generates a brain wave is you get a group of neurons that begin to fire. And they begin to fire together collectively, and then they begin to resonate together in different parts of the brain, and that generates your brainwave. And with the higher brainwave activity, that's going to be a healthier brain, typically, especially if we're talking about the cortex. However, the cerebellum oscillates at its own frequency, which is about 8 to 12 hertz. So the cerebellum and what's called the inferior olive come together, and they generate what's called the physiological tremor. And the physiological tremor is what turns your muscles off and on at a certain rate so that you preserve energy, because our brain is all about preserving energy and us being as energy efficient as we can possibly be. So our muscles are constantly turning off and on. Now, when you see someone that has an essential tremor, it's because the firing rate of the cerebellum has been downregulated, and you start to see that tremor come out as an essential tremor. Now, that's different from a Parkinsonian-based tremor, which is in the basal ganglia. Similar idea there, but I use that to point to the oscillation rate within the cerebellum and the inferior olive. So 8 to 12 hertz there. So if I want to have an effect on the cerebellum, guess what frequency I'm going to use? 8 to 12 hertz. It responds better to that. You can test it. If I want to have an effect on the midbrain, okay, where the basal ganglia live, okay, I'm going to use the frequencies that correspond to that. And people don't even realize that there's actual research that's been done out there that shows what frequencies can produce what neurotransmitters. I believe it was a NASA study that showed 130 hertz will generate dopamine as though you took a dopaminergic medication. That's huge. Anyway. So you have different areas of the brain that oscillate in different ways. The right brain tends to have more of a gamma frequency. The left brain tends to have more of a beta frequency. When you're asleep, you're more into delta waves. As you're falling asleep, you go through a series of, alpha to theta to delta brain waves. So depending on where in the brain you want to have an effect on, depending on what you want to do I want to reduce functioning in this area? Do I want to increase functioning in that area? That's going to be driven by what frequency I choose to use, okay? That is so important. And what people don't so many people that, just use a continuous wave, just turn on, doesn't matter. Yes, it does. One study to point to is, in fact, one that they were looking at the vagus nerve. Super important, I don't even like saying vagus nerve. I'd rather say vagal system. It's, everything to do with your social engagement, your organ function, your brain, blood perfusion. It modulates your inflammatory load. It, regulates hormones, all these things. So they were looking at, can we turn the vagus nerve on using light? And they compared continuous wave, AKA no frequency, to 10 hertz. And what they found was that when they shined the light on the bottom of the foot, of all places, with continuous wave, there was no effect on the vagus nerve. When they used 10 hertz, you began to see the vagus nerve start to function. So even just, in the literature, it's very well established that frequencies matter, okay? So that's my, little rant on frequencies. Again, I could go for a very, very long time on that. But that's my spiel, guys. So I don't know, I may have missed a few things, but those are really, kind of the guiding principles about what I do and how I'm using laser and light therapy, a little bit about functional neurology. So like I said, I know each and every one of you have, certain reasons why you're on this call. So that's what I want to do at this point in time, is really just, give the floor to someone, ask a question, and let's get into it.
Dr. Crawford, what about clonus in the foot? How would clonus of the foot, when you push on the bottom of the foot and it starts to pulsate, is that also part of that tremor?
So clonus in the foot. So, a problem that I see is one of misdiagnosis. Now, I'm not saying that applies here, but there's a very different, type of thing going on in the brain with myoclonus versus rigidity versus spasticity. And that's what some people don't really realize, is that a rigid foot is a different area of the brain versus a spastic foot. Myoclonus is going to be that very quick, jerky movement, and it has no rhythmicity to it. So, if you're asking about how to make clonus go away in a foot, the first step is to identify what area of the brain does it correlate to, and is it in fact clonus? Because if it's more spasm related, like if it's a true spasm, that's going to be more motor strip or cortical based. Or is it more rigid? Like, can it move, and does it have a cogwheel versus a lead pipe type of rigidity? That would be more midbrain basal ganglionic in nature. If you touch the foot and it jumps and it holds into a spasm, that could be considered a myoclonus. But, step one is going to be identify the level of the lesion. And then step two is going to be, apply whatever ways we can activate those systems and then laser accordingly. Now, thank you for bringing this up, because that was something that I didn't speak on, was this. It's very well established that you can laser the brain, and you're going to have the most influence with that laser or light therapy on the neurons that are more metabolically active. Now, this presents a problem, doesn't it? Because we're trying to turn networks on, and we're lasering, and the ones that are already turned on and metabolically active are going to be more affected. So, and again, that's where functional neurology really comes in to play here, is we can develop novel strategies to then go, okay, well, I know I want to affect the cerebellum, so we're going to turn it on like this. Or I know we need to have an effect on the midbrain, so we're going to do some arm flexion and some tectospinal reflexes and start to get those neurons to fire. And then I'm going to laser at a very specific location with the right frequency, wavelength, and power in that regard. So thanks for reminding me about that. But yeah, going back to your question about clonus, it depends on the diagnosis, but again, identify the level of the lesion and then, work accordingly to activate those systems and then laser on top of them.
Well, the reason I bring it up, because it's not all the time. It's very infrequent with Olivia. But it's like you just touch the bottom of her foot and you get that fast little jerk and then it stops. And it doesn't happen very often. So I'm kind of like baffled. I'm trying to pinpoint, like, figure out, is there like correlation to anything that's changed in her because it doesn't happen frequently? I don't know. Yeah,
well, so is it more one side versus the other?
Yep. It's the left side.
Okay, so it's more left side. So, it's either it's most likely some type of right brain network. And, is it more of a Babinski reflex? Or is it more of a true withdrawal sign? Those are questions that need to be identified, right? Because those are all going to point to different therapy strategies. You can see, differences in reflexes at different points in the day based on receptor activation. And, could there be some type of receptor-based issue going on as well? And what I mean by that is, could there be an autoimmune attack or an inflammatory load on a receptor, and that receptor then ramps up or down and allows a group of neurons to either fire or not, or fire too much or not fire at all? And then you're going to get different responses based on, what's going on at that neuronal level at that point in time. What's ramping up the immune system? What's ramping up the inflammatory load? So on and so forth. So, again, all those things need to be figured out. But it really just basically boils down to where is it, what is it, and how can we have an effect on it,
Is detox, could detox cause it too?
Does detox cause it too?
The change in, the chemical change that's going on and pulling out metals and.
Yeah, so I don't always like to jump right into a detox. I've come into this roadblock several times. And the first thing that needs to be done if you're going to detox someone is you need to check the integrity of the blood-brain barrier. If the blood-brain barrier integrity is not so good, your blood-brain barrier can be leaky just like a gut barrier. Then before you, people are asking questions on there. That's cool. So I see those questions popping up, but they go back down before I can read them. Sorry. So if the blood-brain barrier is leaky or inflamed and we start pulling out, metals and plastics and all these things, all those things have to circulate through the blood, and that blood goes through the brain. So you can actually, expose the brain to those things if the blood-brain barrier is not healthy. And so that's something that I really like doing if someone's considering a detox. And I have seen some really severe, very complicated neurological disorders, and they kept on doing detox after detox after detox. And when we looked at the integrity of the blood-brain barrier, it was terrible. And they always reported that, while we were doing the detox, the neurological symptoms were terrible. Like they got so much worse. And the practitioner simply said, oh, well, that's a detox effect. No, that's not just a detox effect. You're actually causing some harm at that point in time. Again, I'm a big proponent of checking the blood-brain barrier if you're going to do a detox. The barrier typically does not close until about age 2. So if your kiddo is less than that, then maybe we don't want to do a heavy detox. Maybe we want to do a very slow, gentle detox. Maybe we don't want to do one at all. So yes, detoxing can have some adverse effects, but again, it goes to the integrity of the blood-brain barrier and if that's been checked.
Okay. I don't want to, hog up all the time, so we'll talk some more later.
Perfect. Okay.
Doctor, this is my name is Paul. My daughter suffered a near drowning in February, and the primary areas of damage that were described to us from the neurologist were the basal ganglia and the brain stem. Kind of how would your treatment, how would you best use your treatment or a protocol in her case? I know it's obviously based off of her condition and whatnot, but sort of I know you were talking about this treatment being able to sort of target areas based on the brain frequency.
Mhm.
So I was a little bit curious if you could elaborate on that a little bit.
Sure. Yeah, no, that's a great question. The brainstem, the basal ganglia, those are very difficult areas to reach. And one lecture I did was solely discussing that laser and light therapy can, in fact, have an influence on the mesencephalon, which is, the deepest part of the brainstem. It's like literally right in the middle of everything. So number one is there's research that shows, yes, we can have an effect. There's three effects that were described in that literature. There's a primary, secondary, and tertiary effect. And click on chat to see the questions. Okay, all right, thanks. But here's how I would really approach it is like this. Identify as best as I could, is it more right or left? Is it more direct path? You mentioned the basal ganglia. So is it more direct pathway or indirect pathway? The indirect pathway is like our brake pedal. It causes us to stop and slow down and really, inhibit our actions. The direct pathway is like our gas pedal. It makes us go, and makes our mental processes go and all this kind of stuff. It's our drive and our motivation. We can look metabolically. Is it more D1 or D2 pathways? Receptors. D2 receptors are indirect. D1 receptors are direct pathways. So identify right or left, what type of receptor, what area of the brain, and then there's strategies to start to activate these neurons. So for example, if you mentioned the basal ganglia, we could fire a tectospinal reflex. That's one of my favorite ways to do it. You have either a loud sound or a flash of light in the periphery. And what happens is you actually have the reflex to turn towards the stimulus, and that fires into that area of the brain. There's other ways to do it depending on the level of the brainstem. Like in the medulla, you can use taste, which fires solitary nucleus. In the pons, you can use various eye movements or vagal stimulation. You can use facial vibration, oral vibration. We can use electrical stim on the tongue. We can do all sorts of things, again, to start to activate those areas that appear to be most damaged, because that's step one. We need to activate those neurons if we're going to have the greatest influence of using laser therapy. Now, if we're trying to get to the basal ganglia, we're going to want to laser certain parts of the cortex, and then we're going to want to go up through the nose, which is going to be the best access point, in fact, to get to the basal ganglia. If we're going to get the pons and medulla, we're going to go through the mouth or through the back of the neck, again, while co-activating with certain types of stimuli. So there's all sorts of different strategies, and it really just boils down to where the lesion is and what the primary issue is at that point in time. So does that kind of give you some direction?
That gives me a great direction, as that seems to be sort of her problem area based off of the MRI described. Essentially, there's a lot of white matter in those areas, and luckily a lot of gray matter in all the areas where they were hoping to see, but those were the two primary areas in the very deepest part of the brain that he mentioned were sort of inhibiting her ability to access any of that other information. The other question I had too is that she's currently undergoing hyperbaric oxygen therapy, and it was recommended to me by the doctor overseeing the practice to get her a functional MRI. Is that something that you're familiar with? Is that something that you use in your practice that helps sort of give you a better idea as to where the problem areas really are? Or is it more so along the lines of the light therapy that you guys have been using to determine that?
No. So in the way that we determine where and what to treat is based on our functional neurology exam. Functional MRI is great, but it has limitations, just like every other diagnostic tool.
Sure.
Functional MRI is going to really look at blood flow, but unless you really challenge those areas of the brain to increase blood flow into them, it's difficult to really say, what's going on there. The PET scan of the brain can be a little bit more beneficial, in my opinion, just because that's really looking at volumetric changes based on cortical activity. Dr. Dan Ammon did a whole lot of that research in his practice. But so what we do is we use a real-time functional neurology-based exam, developmental functional neurology-based exam, and that is really the core of what we teach in our courses. So we know that certain primitive reflexes correlate with certain areas of the brainstem. We know how to test the basal ganglia. We know how to test the cerebellum. We know how to test the cortex. And then we can challenge it to make sure that those areas, those are in fact the areas that we want to focus on. So I want more of a real-time test, because when I start working on someone, they start to change. So I need to be able to look at them and go, okay, we need to move out of the medulla and into the pons, or we need to move out of the basal ganglia and into the hemisphere, so on and so forth. So I want a real-time way to really measure change in how we're having an effect. So while I love functional, fMRI, I love PET scans, I love MRIs, all that kind of stuff, that's great. But from a functional standpoint, I'm not going to be ordering a lot of those. Again, it's good information to look at and to help localize lesions. But like I said, everything has some limitation to it.
Thank you so much, Doctor. I appreciate it.
Yeah, thanks for your question. Okay, let me see if I can get down here. Okay. Okay, so someone asked here, are brain cells that died able to be resurrected, or is the goal to try and heal the pathway around the dead cells once the cell is dead? Is it dead? Okay. That's a good question. And it's like this. Once a neuron is dead, it is typically, in fact, dead. Okay, so, but here's the question. Is it truly dead, or is it dormant in order to preserve energy for the rest of the neurons in that network? If it's dormant, then it can, in fact, come back to life. But even if it's dead, we have something called neuroplasticity. And so we can reroute, if you will, we can build new connections and new synapses all the way up until we die, actually. Now, the reason why, the theory in neuroscience is that you cannot grow new neurons and new connections and all this kind of stuff. It's all based on the idea that when you're born, you have so many neurons and you actively start to lose them throughout your life. And by the time you die, you don't have many left. Now, here's more to that story, is that, yes, that's true. When you're born, you have all these trillions of neurons. But what happens is you start pruning them, if you will, and you start to get more efficient and more efficient and more efficient with your neural pathways. Again, the brain is all about efficiency and energy preservation. So if the brain can develop systems and networks, they're called functional action maps within the brain and functional connectivity, so that it can eliminate how many neurons it needs to sustain in order to thrive, is going to do that. And in fact, there's a very common time of pruning in life is around age 18 months, about 18 months to 2 years old. Now, here's something to consider, is that around that time, that's when, it's recommended to get vaccines. And one of them that's very common is the MMR at that point in time. And so you have this brain that's naturally pruning itself. And then you inject something like, an adjuvant or whatever immunostimulant to someone that has a ramified immune system already, maybe inflamed or whatever, and you kind of compound that pruning effect. Anyway, we won't go down that path at this point in time. But So can you resurrect a dead neuron? At this point in time, from what I've read in the literature, from what I've seen, if it's dead, it may in fact, just be dead. However, you may be able to build new pathways and new synapses so that you can reestablish that function, even though the neurons may be dead. Okay. How do you feel? How do I feel about PEMF? PEMF is great. PEMF, it's another way to raise the voltage within the system. I've used it, over the course of my career. I like light therapy. I prefer light therapy, and it's not just because I own Shed Light. I preferred it before that, but again, going back to the parameters of light, it acts as both a particle and a particle on a wave, so you can deliver more information in a shorter period of time. I think it could potentially be safer. In fact, I think that the effects of light therapy versus PEMF are more far-reaching, personally. So while I love PEMF, I don't use it in my practice because I think I can do all of that plus some with laser and light therapy. Do you see TP from pupils? What are your thoughts on the supplement? Okay, yeah. So someone asking their kids taking a product, ATP 360. What are my thoughts on that supplement in comparison to light therapy? I mean, it's good to support, metabolism like that. I think that's great. You still have to have certain nutrients in order for cells to do what they got to do. So I think that always combining a metabolic approach with light therapy, again, with activating neural systems is the best approach. I recommend supplementation quite often. So, I think it's great. I'm not super familiar with that exact product, so I need to go look at it to really comment more on it.
I'm sorry, I was the one that asked that question, and I was just wondering because I was told to, by a person who was a nutritionist at People's. I saw him aside from the supplement department, and he was saying just that it was, good for brain injury and recovery. But I didn't know. Obviously, red light probably has a different service and purpose than the supplementation. I didn't know if you also supplement like that with ATP with your light therapy to maybe produce the best effect.
Yeah. So, that's another way that I may co-activate someone is, again, let's talk about the dopamine receptors, because we've already kind of talked about those. If I want to, increase D1 receptor activation, again, because the laser therapy is going to have a greater effect on the more metabolically active neurons, I can in fact give them certain products that can increase activation of that pathway in those receptors and then laser on top of them. That is one thing that we can do. So, for a lot of like my stroke patients, I'll have them take something like nitric balance, Neuroflam, a lot of CoQ10 before they come in to start to ramp up those systems. And then when I'm working with them, they're more metabolically active. So, light therapy is going to have a different way to turn on the mitochondria than taking a supplement. But I think taking the supplement is good. In fact, I do it. My kids do it. I recommend it all the time.
Right. That you answered my question. Thank you. The only other was that I think I wrote down there, and now I can't see it on the screen. I know that people buy red light systems from the internet into their home, and it's not assisted. And I don't know your thoughts on that. Because I don't know enough about red light therapy and brain injury. So I don't know if that's recommended without the results I'm not necessarily looking forward to even doing that by myself or without an assistance, but just, I know a lot of people do that, that have had concussions or brain injuries. And what are your thoughts on that?
That's a great question. And actually, I'm really happy you asked because what happened with our company Shed Light is, I started working with Johnny Grant. He's a pretty well-known brain injury case, and we got flooded with requests to purchase our lasers. So we really were just selling to practitioners. That's really what we were doing. We were not set up to sell to non-practitioners. But because of the amount of people that asked and because of the high safety profile of laser and light therapy, we decided to bring in doctors for our staff with Shed Light to guide people, because it's not okay just to sell a product and then give no direction about how to use it, especially if the intention is to change a life. And we feel very strongly about that. So I personally don't advise to simply, buy a red light product without having the knowledge base to properly use it. Now, if you just want to, use it for pain, that's easy. Point and shoot where it hurts. That's pretty simple. But when we start talking about, these more complicated cases, I don't think it's a great idea, because I don't think your money is being well spent in that regard, because you need more direction. You need to know, do we target cerebellum, the brainstem, the cortex? How do we do that? Where do I point? What's the frequency, and all this kind of stuff. So yes, it's safe, but to be truly effective, you need guidance. Now, I'm not at all trying to sell a product at this point in time to this group. Absolutely not. But that is exactly why we're doing what we're doing in Shed Light, because we want people to be able to use a product that is this safe and that can truly change lives. So we brought on the doctors to help people, to hold their hand and make sure that they're doing it, the right way. We get people that literally fly our doctors all over the world. It used to be me, but now I'm, busy doing other things. And so I've got doctors that, like just yesterday, someone requested one of my docs go to Mexico. I've got someone going to Brazil. Again, just to go down there, they bought a laser and now they need help. Now, yes, there's additional fees for that. There's no way I could sustain a company by flying my docs all around the world. But the vast majority, 99% of people, we simply do phone consults or Zoom meetings or something like that, to give guidance and help you out. Does that answer your question? I take silence as a yes.
Yes, silence is a yes. It's also computer illiterate is a yes. Thank you.
Sure. Okay. Does laser therapy improve cognitive function, and should we ask for EEG to be done to determine if this is an option for us? So, does laser therapy improve cognitive function? Absolutely, yes. There is research that is undeniable that it does improve cognitive function. I personally use a Cambridge cognition test in my practice on those that can take it to show that it improves cognitive function. Yeah, that's a resounding yes, just to be honest. Should we ask for an EEG to be done to determine if this is an option for us? The answer is no. An EEG is going to tell you what your brainwave activity is at that point in time. Well, what about when you start reading? What about when you're engaged in an activity, to do math or whatever? Your brainwaves change. So do you need a EEG to do it? No, absolutely not. Okay. EEGs, by the way, they're really looking at cortical function. And if you do it wrong, you can pick up, you can even pick up some signals from the facial muscles. You can pick up, the frontalis muscle and all these things. I only know that because I'm talking with neurologists to design our studies, because when we're using EEG to measure the effect that we're having with the laser, I want to be sure that, I'm not just measuring a masseter muscle. So again, there's limitations to the EEG, and it needs to be better make sure that you do it right, or you're going to get false information. Okay, another one. Are there contraindications for seizures? Let me tell you a story. I went up to help someone who was having multiple seizures a day. They were in a rehab facility. And here's the thing. In the literature, you're not going to, it's stated, it's been tested, you're not going to induce a seizure with laser therapy. You have to really, really, really push the power up so high. Like literally there's maybe 1 or 2 devices on the market that you could really get the power that high for a sustained period of time to really get to the temperature, or to really increase the temperature inside the brain to induce a seizure. So it's extremely difficult to do that. And again, when you look at the research, it's not really done. So I went up, I helped this lady. She was having multiple seizures a day, and we started doing laser therapy. We did some, obviously the functional neurology, all the things that I do. Seizures went away. She didn't have any seizures for months. And then all of a sudden she started having seizures again. Well, when all this COVID stuff happened, the family members and whatnot that were going in doing the laser therapy and doing, all the things that we had discussed, they were not allowed to go into the facility anymore to do these things. Well, so when they said, well, why is she having seizures again? They said, oh, it must be the laser therapy. Well, wait a minute, time out. We haven't been going and doing it. And in fact, when you looked at the notes, they were not doing the laser therapy anymore on this person. And guess what? The seizures came back. So that's just my story proving, hey, it actually stopped them. And then when they stopped the laser therapy, they came back. Now, so again, no, you're typically not going to induce any seizures. You don't, have to worry about that. And in fact, you can see that it can actually reduce seizure activity. Okay, let's see. So someone asked about, what is PEMF? I'm not going to go down that, path right now. I want to stay kind of focused here. You can Google pulsed electromagnetic frequencies. It's a type of electromagnetic wave that you can do. I know people are buying red light in cells or homes. Okay, we talked about that. What supplements do I recommend? Depends on what's going on. So that would, obviously, like I said, fuel and activation. So we want to take a look at the person and make sure that their brain is adequately perfused, make sure that receptors are being activated and can sustain that activation, make sure that there's, enough fatty acids. Brain EDHA by Apex Energetics is absolutely one of my favorites. The brain is mostly DHA, docosahexaenoic acid. So I want to make sure that the person is getting lots and lots of that. So brain EDHA is absolutely one of my favorites. Something to support, again, perfusion to the brain is huge. I'll use Neuro O2 by Apex Energetics. I may use Anginox by Zymogen. I may use Nitric Balance, again, by Apex Energetics. But those are kind of my favorite ones. And it kind of depends on what's going on. Nitric Balance is a liquid, so it's easy for, kids or adults with G-tubes. Anginox is a powder that can be, made into a liquid, obviously. That one is, it's good for peripheral blood flow as well. It helps induce nitric oxide. My favorite is Neuro O2, but that's a capsule. So you need to be able to swallow it. And that's, again, Apex Energetics for that one. But yeah.
Can it be administered through a G-tube?
The capsule?
Yeah.
No, I'd rather use Nitric Balance through the G-tube. Yeah, I'd rather not open the capsule and go like, I'd rather use Nitric Balance.
Great, thank you.
Sure. Let's see. Oh, okay. So I heard that when you stop using a laser, you lose the results. No, actually not true at all. I see time and time again that those results are maintained. Now, if there's regression after, like, for example, someone comes and spends a week or two with me, they get great results. Then I, do a 1 month follow-up and they're like, man, we're starting to regress. What's going on? 2 questions. Number one, are you doing the home exercises to continue to fire those pathways? All right. That's super important. But number 2, if there's like really regression, then we really need to rule out a neurological based autoimmune issue that's causing receptor issues and an abnormal firing rate. Because if you have a neurological autoimmune problem that's creating inflammation, that is a huge roadblock that we need to get rid of. And that's honestly, that is the most common reason why someone would come to me, get results, and then lose those results is a neuroautoimmune issue. So if you're, using a laser and that stuff isn't really present, you're going to sustain the results. But another thing to consider here is that laser therapy and light therapy is well established to reduce autoimmunity and reduce inflammation. actually what it does is it regulates it. Laser therapy is known as the great regulator in the literature. And what that means is that it's going to balance your immune system. It's going to balance your inflammatory load. But that takes, not constant use, but that takes more of a long, duration. So when I see someone that regresses, then, that's typically what's going on, is some type of neurological based autoimmune problem. Otherwise, no, we're going to get those networks firing and you will continue to fire them, period. All right, let's see. We got Eeg Neurofeedback. All right. Yeah, so someone's asking, have I heard about EEG neurofeedback? Yeah, absolutely. One of my good colleagues, his name's Dr. Michael Crawford. He's located in Asheville, North Carolina. Absolutely, one of the best EEG neurofeedback docs out there. If you need his information, feel free to, just write his name down. Really, Michael Crawford, Trayford. He's, if I need someone to do EEG neurofeedback, that's where I send them. I consider that more of a finishing type of modality. And what I mean is this: if I get someone with a severe brain injury, I'm not going to go straight for neuro, feedback with EEG, because we need to get the cortical function to increase first, because a lot of EEG has to do with, being able to focus and your attention and whatnot. So that's more of something that I'm going to do at, on the back end of treatment. Once they've gone through, we've got the brainstem, the cerebellum, really starting to fire. And then we start working on balancing the hemispheres. That's really foundational before we start, doing the neurofeedback with EEGs, in my opinion. But, again, when it's the right time for it and when it's done properly, it can be very powerful. Do I have any funk neuro friends in Oklahoma? Functional neurologist friends in Oklahoma. Yes. Where is he? Eric Weedhelm. He's in south of Norman. It's a tiny little town, Ardmore. He's in Ardmore, Oklahoma. Eric Weedhelm. I don't know if I'm saying his name right. Let me look. Yeah, Widhelm, Eric Weedhelm. He's in Ardmore, Oklahoma. Besides that, no. I mean, who wants to live in Oklahoma anyway? I mean, come on, come to Texas. You're that close anyway. You might as well just come to Texas. Just forget it. Okay. Would you recommend getting stem cells before or after coming to see you, boost results, protocol, and therapy? All right, so when we're talking about stem cells, here's what we know. We can actually laser over the area of the brain or body that we want the stem cells to really migrate to. That's really something that's gaining traction in the stem cell world. And I've got docs using our lasers right now doing just that. They'll, they'll inject stem cells in a knee, and then they laser, over the area of the knee they want it to have the greatest effect on. Same thing with the brain. I know a doc that, they'll inject stem cells for the cerebellum, and then they laser the cerebellum because you don't necessarily want it to go systemically. You want it to have a very targeted effect. So that's what we're saying is, so if someone's coming to see me and we can really time it, it would be, in my opinion, I think it would be best to do the stem cells and then come in, and then we can really start, to direct where we want those stem cells to have an effect. One thing that we do see in the literature, okay, is that, who just said something about Baylor? Come on, give me a break. I'm an Aggie, so let's not talk about Baylor in here. One thing that we see in the literature is that laser therapy will cause stem cell migration and proliferation in the area that we're using it in. And so again, that's where they came up with the idea, okay, well, let's inject stem cells and then laser the area that we wanted to have the greatest effect on. Let's see. Where'd he go? How long do you typically need light therapy? Also, can you detect if my child is getting proper CSF flow or oxygen to the brain? So if you're not getting adequate CSF flow, cerebral spinal fluid, you're typically in a lot of pain. I mean, that's going to create, rather traumatic headaches, and it's typically pretty apparent at that point in time. Now, the oxygen question requires a little bit more clinical skill, because you can put a pulse oximeter on someone and it can be 99 to 100%, yet they're not perfusing the brain. Okay, so you have to be able to identify that from a clinical standpoint. And yes, that is something that I absolutely look at. There's various ways you can look at on the exam to see if someone is in fact perfusing the brain. One of those things is simply, how quickly can I fatigue you? If it's real quick, fast, and in a hurry, then you're probably not perfusing your brain very well. Do you fall asleep after reading one chapter in a book, after reading one paragraph in a book, after reading one sentence in a book? That all speaks to frontal lobe function and brain perfusion. So, there's various strategies that I'll do to look at perfusion. And then what was the other question? Where'd it go? Sorry, I keep on coming off of the questions because I like seeing faces when I talk. Otherwise, I feel weird, like I'm talking to my computer. All right, how long do you typically need light therapy? That is going to be so variable and specific to that person, to their injury, to their overall metabolism, to the area of the brain that is most involved. Paul asked earlier about the basal ganglia. That's going to require more time because it's a deeper area and it's poorly perfused. When you compare it to the rest of the body or the rest of the brain, it just does not get as much blood flow. And that's why, like, for example, when we see someone that's had a non-fatal drowning or some type of hypoxic or anoxic brain injury, very common areas that we see residual damage in is going to be the midbrain basal ganglia area, the cerebellum, because the cerebellum is the most sensitive tissue in the brain to oxygen. And again, the basal ganglia because of the poor blood flow, comparatively speaking. So how long you're going to need it, highly variable. I've had people seriously, like I had a lady with vertigo. She comes in, I have vertigo. So, okay, we're going to do this. We laser her, we activate the brain. She literally hasn't had vertigo since. I'm like, that's great. It's been like a year. I have other cases where it takes longer. Again, totally depends on that person. Okay. I've heard that when you stop using the lasers, okay, we asked about that. Have you successfully eliminated tremors in patients, tremors in hands and core? Absolutely. Yes, we can effectively eliminate tremors. That's a very complex question, though. Again, going back to, is it more cerebellar? Is it more basal ganglionic? You mentioned the core, so it's a truncal tremor, so it's going to be more midline cerebellar in nature. There is most likely a metabolic component to that. So what do I mean by that? I mean, there's probably some type of anemia. There's probably some type of autoimmune issue going on, whether it be on the cerebellum itself or acetylcholine receptors or other types of issues going on. So the answer is yes. Some respond really quite rapidly, and others are going to take longer. The ones that are going to take longer are the ones with the more involved metabolic complications. But yes, we can absolutely reduce and eliminate tremors. Yeah, agreed. Come to Texas. Okay. All right. Next time you're helping me with my vertigo, please. Oh yeah. Okay. Sounds good. Voitums. So we need to, so I didn't know you were having vertigo issues. So let's, you, me, and Damien, we can game plan and make sure that we get rid of that vertigo for you. I actually have written up a vertigo protocol, by the way, in our manual. I just finished it not that time ago, or not that long ago. So I'll shoot that over to you. If I don't, just message me to remind me. How do we get started with me? So you can email our general email, which is austinbraindc@gmail.com, and just, get started like that. Just say you want to, come in and get evaluated or whatever. I do phone consults for people all the time, so all over the globe. So we can set up a phone consult or a physical exam consultation, or you can call. The number is 512-659-7449. Is that right? Let me make sure. I never call it. Yeah, 512-659-7449. There you go. Okay, let's see. What are the typical gains you see? Well, again, highly dependent on what's going on. If you want to elaborate on that as far as, gains for what, I can speak to it more. What are my thoughts on taking NAC, which is your N-acetylcysteine supplement? I hear it helps with mucus. My son's not stopped sneezing and blowing his nose after his injury. So NAC, that's N-acetylcysteine, is a precursor to glutathione. The cool thing about NAC is that it really helps with your intracellular glutathione production. It does help with extracellular glutathione production as well. I'm not really sure if it helps with mucus. I know it helps with detox pathways, but if I'm going to really, help someone with mucus production and, clear their sinuses and all that kind of stuff, I use a product called Antranex, and that's by standard process. It has a liver enzyme called yakatron in it that the Japanese have been using it for like 2,000 years. But what it does is it attaches to the histamine molecule, so it helps with that, but it also helps detox the liver. Super safe, super effective. The only side effect is it'll cause loose stools. So whenever allergy season hits around here, I have people dose up until they actually get loose stools, and then they can back down a little bit. So I like that product. And again, it's Antranex, Antronex by standard process. But NAC, it's a great product. I don't know if it'd be my only product for, that specific situation. What type of records we need before coming to Texas? Just email or, call us and we'll talk about that. Let me see. Is there a supplement? Okay, so is there a supplement that I would recommend while this is Paul, while she's currently undergoing HBOT prior to her time with me? Helping her, I would probably recommend, if she's, on a G-tube, then I would go with the nitric balance. If she can swallow pills, I'd go with the Neuro O2. Both of those are Apex energetics.
How is that spelled?
Yeah, so there's nitric balance, which is the liquid product, NITRIC balance. And the company is Apex Energetics, APEX, and then energetics, so ENERGETICS. Again, going back to you, Paul, just because you mentioned the basal ganglia, I would recommend. Yeah, how old's your daughter?
She is 20 months at this point.
Okay, so she's 20 months. So what I was going to recommend was, perhaps it would be a good idea to go ahead and do a neural zoomer test, which is looking at neurological autoimmunity, because whenever there's a lot of stuff going on in the basal ganglia or the midbrain, I really like to check those dopamine receptors. Now, they have a finger prick test now, by the way, so we don't have to pull lots of blood. I can order that if you needed, but basically at 20 months, it's hard sometimes to say because she may not be producing enough antibodies to register on the test. But I'll be honest, in my experience with a brain injured child, they are producing antibodies. And again, that's going to complicate things. And, but what that would tell us is, do we need to increase a D1 or a D2 pathway? Do we need to take more of a right brain, left brain approach? And there's, nutrients, that we can do with that. There's stimulus or different exercises and activities that we can do for that. So I like to have that information if possible. So yeah, again, that's the Neural Zoomer. It's offered by Vibrant, and you would need a practitioner like me to order it.
I'm not sure, as located in South Florida, if there's anyone that's nearby me that's even capable of doing it. I know that there's a center in the Orlando area of functional, obviously functional medicine like this. I don't know of anyone nearby the Naples, Fort Myers area, which is where I am,
Yeah.
that currently offers.
Let's see. How close is Stuart, Florida, to you? Is it close?
Stuart, Florida, I would say maybe three or maybe 3 hours, 2.5, 3 hours, something like that.
I've got a guy in Stuart, Florida, that you could probably go see. Dr. Steven Zamfini. He's a friend and colleague. He's done the courses that we've taught, and he's a great guy. So I'm rather certain that he does that testing. But again, if not, then I could easily order the test for you. They could ship you the test kit. It's super easy.
That would be fantastic. I'd be more than happy to do it that way too.
Okay. Yeah. Either way, I mean, you could email or call the office, and we could try and get that done. But if you're looking for someone local, then I would probably connect you with Steven. Yeah.
Fantastic. Thank you.
Sure. Let's see. Okay. You do blood work and have Kate to help nail down specific supplements and food for individuals, correct? Yes. So the question is, do I do blood work? And my functional nutritionist name is Kate Caro. Between us, yes, we do labs, sometimes rather extensive labs, to really get good nutrition, get the diet right, and really nail down some of that stuff. So yes, that is true. Okay, for the gains, cognitive, motor, all the above. Okay. You didn't really narrow it down. Come on. Okay, so how long before, let me see, what was the original question? How long before we see the gains?
Sorry, I was the one to answer. And so Lily had a non-fatal drowning like a lot of the people on here. And I was just wondering, in general, if when you work with someone and you say you see these gains quickly, what are we looking for to see gains? Is it she's doing something new, or I don't know. I don't know how to.
Okay, so here's how I'll answer that. When I first start working with someone, I ask them, what are your goals? And, if you have someone, let's just say you have a kid that is still in a coma, okay? And I'm just going to use that as an example. And I've had this situation. I have this kid in a coma, and I say, what are your goals? I want them to speak again. I go, okay, let's back up. We need short-term goals and we need long-term goals, all right? So depending on the state of the child, what does it look like that they can do in the short term? And then what are our long-term goals? So, I had a kiddo that, based on my exam, based on what I saw, I really, from my clinical evaluation, thought he was very close to being able to speak. And I said that because of how his brain was presenting, more left-sided than right, how the brainstem was functioning, and all the stuff. And I told the mom, I said, I think we can see words quickly. And in fact, that happened. So that's great. Now, if I get a kid that is just not there yet, I will tell them my goal is actually to gain dexterity in a hand first. My goal is to have them be able to sit upright first, because all of those things precede the ability to speak. So we can't bypass that. We have to go through the milestones, and we have to make sure the brain develops in the proper order. So, the type of gains are going to be dependent on, the state of the kid, and how fast we get those gains, again, is going to be dependent on where the lesions are localized, the, metabolic function of the kiddo, the perfusion of the brain, so on and so forth. Is there autoimmunity and all those things? You know, I'm to the point now to where I'm rather confident that I can say, if you work with, it doesn't have to be me, but if you work with someone in this functional neurology realm that's doing things right, and that's using, you know, laser therapy correctly, and they're using other, you know, neurosensory integration platforms or whatever it may be, you're going to get results faster than anywhere else. I'm rather confident about that. Does it happen for 100% of everyone? No, but it does happen like that for the majority. Make sense? Okay.
Your specialist in Stewart, Florida, he is, what is his name?
Stephen Zanfini.
Stephen
Zanfini, Z-A-N. Let me make sure I spell it right. Z-A-N-F-I-N-I.
Great. We had a pediatric doctor who helped pioneer the TPN treatment, discuss with us the importance of treating, in her case, the thyroid, as well as with growth hormone, to encourage further development while her brain is in this sort of, she's in what would be considered probably a vegetative state at this point. Her eyes open, she's capable of they're responsive to light, things like of that nature.
Mm-hmm.
In the early onset of her injury, she wasn't capable of maintaining a steady body temperature and or maintaining her blood pressure or her heart rate, all of which needed to be regulated by medication. As soon as we started treating the thyroid, that seemed to be cleared up in terms of she was able to, some of these functions that apparently are sort of centered around the brainstem, some of the more, you know, archaic functions of the brain, she is able to do that now. So we've been supplementing with thyroid, and I haven't heard that being a very common thing in terms of brain injury. Is that something that you're familiar with or are used to hearing when it comes to brain injury?
Yeah, there's thyroid receptors scattered all over the brain. And in fact, just because someone has a normal thyroid panel does not necessarily mean that they're properly expressing their thyroid hormones. So I describe the thyroid as the spark plug for the brain and the body. So obviously if something's gone awry there, there's definite problem. And that's a big fuel problem. The biggest fuel problems I see are anemias, autoimmunities, thyroid problems, and GI problems, gut problems. So with any type of brain injury, it is extremely common to see some type of thyroid dysfunction. Here's why. You need to completely break down your amino acids in your gut in order to make glutathione for your body. If you don't make adequate glutathione, you're not going to have a proper expression for your thyroid hormones. And what I mean by that is your thyroid spits out mainly T4 hormone. That T4, about 90% of it, 10% is T3. T4 is your inactive hormone. T3 is your active thyroid hormone. The T4 is going to circulate through the body, through organs and muscles and nerves, and mainly the gut and the liver, and it's going to be converted into T3, which is, again, your active hormone. You then need glutathione to take T3 into the cell and be expressed and have that effect that it needs to have for that cell to work. So if your brain is not functioning properly, you're not going to be producing enough digestive enzymes. You're not going to be properly, digesting your larger protein molecules and making your amino acids. You're not going to have enough glutathione. Therefore, you're not going to express your thyroid hormones. You may have a normal thyroid lab, right, that says, oh, well, you have enough hormone, you have enough TSH and all the rest. But again, maybe you're not really expressing normal thyroid function. So it's very important to be able to identify those things, whether it's, supporting glutathione systems or actually, doing some thyroid medication or supplementation or whatever it may be. So yes, it's very common, something I see all the time, and something that, we have to make sure is addressed whenever we're working with, any kind of head injury. So for sure.
Great, thank you.
Mm-hmm. Okay. All right. So I think this is the last one. So if you think your child has vagal nerve issues with fight or flight, would you go with my practice or with neurofeedback? And do I incorporate a bit of neurofeedback and vision therapy in my therapy approaches? Okay. So the vagal system. You have to understand what the vagal system is, first of all. The vagal system is not just the vagus nerve. The vagus nerve is cranial nerve 10. The vagal system is actually comprised of cranial nerves 5, 7, 9, 10, and 11. And it has everything to do with, like I mentioned earlier, social engagement. It's your facial expressions. It's your shoulder shrugs. It's, all this nonverbal communication. It's your ability to recognize in someone's face whether they're friend or foe. And, it has everything to do with your organ function, your digestion. It keeps your brain adequately perfused, so on and so forth. I would say this. I work on probably 95% of people that come in. We have to work on their vagal system. Anyone that has had chronic stress, we have to address the vagal system. Anyone that, again, has had a brain injury, we typically have to address the vagal system. I do it with, various ways. We can use vibration on certain parts of the ear. We can use vibration in the mouth, on the gut. We can use a pulsed radio frequency device, something that I found out of South Africa, on certain parts of the ear. Again, the auricular branch of the vagus nerve will activate the vagal system on that side, and that same side insular cortex in the brain. Now, do I use neurofeedback in conjunction with that? I don't use neurofeedback because, I haven't been fully convinced that it's something that I really want to start using in my own practice at this point in time. Again, if I see that someone really needs that component, which I'll be honest is rare, because most of these people that are coming in, they need the foundational, functional neurology approaches. We need to build up the brainstem, the vagal system, the cerebellum, so on and so forth. That by putting an EEG unit on someone's head is maybe perhaps going, bypassing a lot of the a lot of the things that we need to address. Let me say it like this. If someone has a primitive reflex still intact and you're going straight to EEG neurofeedback, you're bypassing so much, right? So let's address it this way. If someone is having a, fight or flight response, which I think is what the question said, if someone's having a fight or flight response, then could that in fact be a fear paralysis or a Moreau reflex still intact? And if so, then the answer is not to do EEG neurofeedback. The answer is to integrate the brainstem. The Moreau and the fear paralysis are related to the mesencephalon or the midbrain, different name for the same parts of the brain. And, if you don't integrate that region by firing certain reflexes or by doing certain types of stimuli, then you're not going to integrate that part of the brain. So again, that's why I don't use a whole lot of neurofeedback in my practice, because I don't think that the majority of people coming in are ready for that. But again, I think it's good. I would just rather get someone to a place where their brainstem is developed, their cerebellum is more developed, and then we can, send them off for neurofeedback if needed. Vision therapy, absolutely. We do a lot of color-based therapies. We do, I do a lot of eye movements. I use the Neurosage system, which is neurosensory integration platform. So yes, we do a lot of vision-based therapy. So let's see. What are your thoughts on human growth hormone therapy for brain injuries? End up with HGH deficiency after brain injury and have been treated with HGH therapy. Yeah. So Ashley, yeah, it can be done. It can be done sometimes. So HGH, human growth hormone, has to have active receptors in order to really have an effect. So if you have a brain that is not really that active and you inject some stuff in it, it may not really have that great of an effect. There's been several studies throughout the years. A lot of it is centered around bodybuilding, but for various conditions where people go, well, what makes you bigger and stronger? Well, growth hormone. Okay, let's inject it. And the results are kind of mixed. I know that we can cherry pick certain things and say that, certain parameters are increased and certain parameters are not. I haven't really gone down that path a whole lot in my own professional career. I don't inject people with anything. I don't know that it's necessarily a bad thing. But what I do know is that ultimately you have to fire receptors and you have to integrate the brain. So there's not, I'll say it this way too, there's not a chemical that can induce brain integration that we know of at this point in time. So if you have unintegrated brain regions, you have to fire reflexes, you have to do physical stimulus in order to integrate them. Okay, how long do you recommend staying and working with me? Yeah, the question is, depending on the injury and areas that need attention, how long do I recommend staying and working with me? When someone, especially, with a pediatric brain injury, when someone comes into my practice, this is certainly a relationship. And it is not a magical week where, unicorns come out and everyone heals and then you leave perfectly normal. That's not how it works. What happens is I work with someone for typically 1 to 2 weeks initially in more of an intensive type of model. We do that to create a neurodynamic change to allow for more neuroplasticity to occur. So for neuroplasticity to occur, we need a proper duration, frequency, and intensity of stimulus. So in order for that to be achieved, that's why I like to have someone stay, 1 to 2 weeks initially. We can get that neurodynamic change and then develop strategies for home to continue those neuroplastic changes. Over time, there will be follow-up visits to make sure that we're going down the right path. Again, there's a blueprint for brain development. So oftentimes, there will be a plateau and the parent will be like, hey, what's going on? We haven't seen any change or, whatever. We'll take a look. And in fact, we need to go, oh, okay, we've integrated that part of the brain. Now we need to move on, or maybe we need to change sides or, whatever that may be. So, if I can get some magical unicorns in here, then I will. But until then, that's how it works for sure. Okay. Okay. Is puberty a good or bad time to be in this ABI place and desperate for progress? I mean, puberty is not a good time for anyone, but here's the thing. There's always going to be parts of the brain that are developing, especially in children, whether you're puberty or not. It just kind of, having a brain injury sucks, period. That I'll just say that. Doesn't matter what age you are, going through puberty or not through puberty, you're having changes all the time. Obviously, the more changes that you're going through at the time of the brain injury, potentially the worse it is. So, that's my opinion on that. So, okay. I'm getting messages from my wife. I think I should probably stop. So I'll just say this. Thanks for everyone for coming in, for letting me talk to you for a bit. I really enjoyed it. I hope that you gained some information. I don't mind doing this more. I'm totally up for it. I think we're going to talk about CBD in the near future. If you guys have something that you really want to focus on, let Rhonda know. And, if I can do it, great. I have a lot of colleagues with, that are very specialized. So if I don't know it, then I'll get someone that does. So I think that Rhonda created a great platform here, and let's continue to use it, to get the best results for everyone.